Back in the 1990s, medical professionals here in the state of Texas had a hard time planning their cash flow. They would see a patient, they would perform a valuable service, and they would send their bill up to Connecticut or wherever the insurance company was, and then they'd never get paid. But the light bill had to be paid, the mortgage had to be paid, and they deserved to be paid on time, but the insurance companies were playing games with them.
In my medical career as a practicing cardiologist for 10 years, one of the biggest hassle factors were dealing with third-party payers, be it Blue Cross Blue Shield, Aetna, United Healthcare, what have you. When we submitted claims, which we felt were clean claims, invariably what would happen, the third-party payer would deny them or delay the payment.
By enforcing prompt payment by insurance providers, we're enabling a more efficient care process that allows the provider in the future to focus on patient care and less about recovery of monies from insurance companies.
There is no reason in today's technology and today's world in the 21st century to have to wait 6 weeks or 8 weeks to get paid on a bill.
The Texas Prompt Pay Act exists to assist doctors and hospitals and now pharmacies also in recovering penalties and interest for the systematic late payment of claims and in some cases underpayment of claims by health insurance companies for the services they provide to patients in the state of Texas.
It's the first thing the legislature did that really had teeth that the medical community could use to get paid properly. It's a state law. There are several states that have laws that are similar. Texas is considered one of the best because it really gives the doctor equal bargaining power with the insurance company.
What has surprised me is within the provider community, how very few physicians and even billing specialists are aware of the Prompt Pay Act and what type of recoveries they may be entitled to.
When a medical doctor or a hospital provides valuable medical services to the people of Texas, they deserve to be paid for that. They deserve to be paid on time. We have spent $4 million developing a software so that we can offer this service to every single hospital, every single medical provider in the state of Texas, and we've automated it in a way that we can handle many doctors at once, many hospitals at once, and it's our goal to make this service available so that each and every medical provider, every hospital and every doctor in the state of Texas can make a claim with the health insurance companies and make sure that all of the claims that were paid late are also paid with a penalty that Texas law requires.
The software that was created really digs into the raw data that's exchanged between the providers and the insurance companies and identifies exactly what's getting passed back and forth and all of the prompt pay violations and all of the penalties and interest, fees and costs that are owed to the doctor.
The program can take that data and very easily process it into a damage model that's created in the form of an Excel spreadsheet, which has many different columns and categories to go claim by claim over a 4-year period and calculate penalties and interest and figure out how much the doctors and hospitals and now pharmacies are owed.
If you have computerized 835, 837 claims and remittance data, it's really about a 3-hour process where we come in and get your contract so that we know which arbitration service to file the claim in front of, the venue provision in the contract so that we know where to file that claim, and then we do what's known as a flat file download, which is really as simple as plugging a cord into a hard drive and downloading the data.
If you're a medical provider, the amount of staff time it'll take to work on this program is very little. Generally, the information we need is from your clearinghouse or from some other third party. To the extent we do need staff time, it's usually less than 3 hours.
The wonderful part of our Texas Prompt Pay Act recovery program is the utter delight and surprise that a lot of our clients have with respect to the size of the recovery. There seems to be a psychology inside of collections departments that consists of 2 pieces of data. How much did we bill? How much did we collect? A collections department that recovers 98% of the billed rate is considered excellent. Sometimes people think that I'm coming in to find the extra 2%. We're not doing that at all. We're there to congratulate the efforts of the billing and collections departments that doctors and hospitals have, but we're also there to collect the penalties that they are entitled to for the amounts that they already recovered, but recovered late.
There's really nothing that the doctors and hospitals have to lose here. There is no retaliation, it's illegal.
Medical providers don't have to pay anything to begin this process. The deal that we have is that we pay for everything. We paid the $4 million to develop the software. We pay the experts to analyze the data when it comes through. We pay the consultants to come up to your office and to collect the data. We pay for their travel costs. We pay for the arbitration fees. We pay for any discovery costs. The bottom line is this law firm picks up all of the costs and then keeps a percentage of what is recovered in a contingency fee so that the doctors know that for every dollar recovered, they can count on keeping 50% with no questions asked.